see some tips of NCLEX-RN related to some medications and the nursing implications of those medications. The first medication is antiarrhythmic drugs, which include amiodarone, sotalol, ibutylide, dofiltilide, dronedrone. The nursing implications when these antiarrhythmic drugs are administered are obtain baseline electrocardiogram and vital signs, monitor vital signs during any procedures if it is preoperative or operative or postoperative, communicate all medications to the anesthesia team if the patient is going for a surgery. The continuous monitoring of the antiarrhythmic drugs provide early detection of deviations. The second group of medications are antihypertensives, which includes captopril, clonidine hydrochloride, metoprolol, atenolol, losartan, olmesartan, telmisartan, valsartan. The nursing implications are to monitor blood pressure and communicate all medications to the anesthesia team if the patient is going for an operation. Hypotensive crisis can be prevented through early monitoring and early detection. So we need to monitor antihypertensive drugs also. The third group of drugs is corticosteroids, which includes dexamethasone, hydrocortisone, prednisolone. The nursing implications are assess for hyperglycemia, infection, bleeding and wound healing, splint the incisions to promote healing in surgery, continue therapy during the procedure if the patient is going for an operative procedure. Continuing the therapy avoids withdrawal and adrenal crisis. Next medication is anticoagulants, which includes warfarin or coumadin, heparin, aspirin. The nursing implications are obtain baseline coagulation studies, taper the medication at least 48 hours prior to the procedure, have vitamin K and protamine sulfate available as antidotes if excessive bleeding occurs during the procedure. Obtaining coagulation studies at intervals during care can detect trends and potentials, and it will potentially prevent hemorrhage. Vitamin K, it is the antidote for coumadin or warfarin, and protamine sulfate is the antidote for heparin. Non-steroidal anti-inflammatory drugs, which include ibuprofen, aspirin, naproxen. So inform the physicians if the medication has not been withdrawn before surgery. Bleeding risk must be assessed by the physician if the patient is on these medications. Next is anticonvulsant. These medications include phenobarbital, phenytoin. Must be alert for the potential of seizures because they can cause injury during a procedure. Maintain medication schedule, have suction and oral airway available. Maintaining the medication prevents seizure and injury in case of anticonvulsants. Next group is insulin. The nursing implication for a patient obtaining insulin is closely monitor blood glucose level. It is essential to monitor the glucose level so that treatment can be quickly administered with abnormal glucose levels. So here, through this video, we understood certain medications like antiarrhythmics, antihypertensive, corticosteroids, anticoagulants, non-steroidal anti-inflammatory drugs, anticonvulsants and insulin, which must be taken by the patient even if the patient is going for a surgery or an operative procedure. Hope you understood this video. Thank you so much. Please do keep watching.